Welcome to Big Blend Radio with your hosts, Lisa and Nancy, editors of BigBlendMagazine.com.
Hey, everybody. Welcome to Big Blend Radio's Quality of Life show. You know, every third Wednesday, we get to talk with Dr. Jackie Eubany, or I should say Jacqueline Eubany, about heart health. And Dr. Jackie, we call her Dr. Jackie because she is Dr. Jackie. Yeah, she is a board-certified cardiologist and electrophysiologist. She's also the author of the best-selling book, Women and Heart Disease, The Real Story. And I encourage you to go to her website, womenandheartdiseasebook.com. She's on Facebook as well. And of course, you can get on Amazon, all those great places. But her website again is womenandheartdiseasebook.com. So welcome back, Dr. Jackie. How are you?
I'm good. Thanks for having me.
Hey, Nancy and I always have our, fun with you. I know it's a serious topic, but somehow we manage to have fun doing this. It's a big deal. And when we talk about heart health, heart disease, heart attacks, they affect how many people, when we look at cancer, where are we, like heart disease versus cancer in regards to those numbers?
Yeah, heart disease and stroke, because they're usually both considered to be cardiovascular disease, remain the number one killer of people in the United States. Much more common than cancers.
Wow.
When we think about breast cancer in women, we say that cardiovascular disease is 6 times more likely to cause death in women than breast cancer. So overall, cardiovascular disease is number one in terms of mortality or death rates.
It's wild. We've been doing these shows with you for years, and you like bringing us back to those numbers each time is still like a mind-blowing thing. I mean, as a doctor, do you feel that too? Like every day, like, dude, everybody reverse your lifestyle right now.
Yeah, no, it's mind-blowing, but like you said, something that can easily be reversed with lifestyle changes that's still causing a lot of deaths. It just means that we need to do more education, and we need to teach people so that hopefully they can live a better life and a longer life with few complications.
Yeah, because we want to be able to walk that, hill, like walk up the hill or, play ball with our grandkids, things like that, just some general,
exactly.
We don't want to have that, we don't want the health to get in the way of happiness,
Yes,
so.
You want a good quality of life, towards the end. Absolutely, good quality of life.
So you mentioned strokes, and that's something we're going to really focus in today is strokes and heart health, heart disease. And so, I want to go, which comes first? I know the chicken or the egg, right? Which comes first, the stroke or the heart attack? And let's just break it down. What is a stroke and what is a heart attack? I mean, because Nancy, isn't it true everyone we know that have had a heart attack, they've had a stroke or a stroke and they've had a heart attack?
Well, it's hard to say. We did witness one person having what we thought was a heart attack, but turned out to be, I guess, a stroke. We're still not sure because we were, and we couldn't understand everything that the doctors were saying, but did grab his chest and he did fall over. But so I don't know, because like I say, we were in Mexico and we couldn't understand everything that was going on. But I think, I don't know. I mean, everything's so closely related, your heart and your brain. And if you don't get oxygen or blood flowing through your body, I think it does damage in a ton of different ways when you have a stroke or a heart attack.
Absolutely, absolutely right. So we can start off by talking about a stroke. So what happens with a stroke is that you have the blood vessels that supply the brain with the oxygen and nutrient it needs gets clogged up. It can either get clogged off by cholesterol buildup or a blood clot. So basically it clogs off so the brain doesn't get enough oxygen and nutrients, and then that part of that brain dies. So all the function associated with that part of the brain then doesn't work, and that's why you get symptoms of stroke. Now, heart attack is also a similar kind of thing. The blood vessels that supply the heart with all the oxygen and nutrients it needs to function normally also gets blocked. And this blockage can happen with either cholesterol building up within the vessel or a blood clot being thrown, quote unquote, thrown into that vessel and clogging it up. So when that happens, again, that tissue associated with the heart or that tissue that gets supplied by that blood vessel also dies, and so the heart then doesn't function very well, and that's the definition. So very similar. So it's basically if you have a high cholesterol or a lot of those risk factors that increase your risk of forming plaques in your arteries, then you are at high risk for having a stroke or a heart attack.
So really, we go back to the clogged drains. I know we talked about that a couple shows ago. Like it's like look at your vessels, your veins. And it's like, when you do the dishes and you've been cooking up a bunch of bacon and you have all that grease, if you put it down your sink, you're going to have to call the plumber. So
exactly.
That's what
that's
could
exactly
happen.
what it is. Yes, that's a good analogy, actually. It's kind of like a clog over time or your drain clogging up slowly over time with the cholesterol buildup. You get less and less water being able to drain at a quicker and quicker time until it completely occludes, and that's exactly what happens with a heart attack and a stroke in the blood vessels in the brain or the blood vessels in the heart.
Now, did I do good saying bacon grease?
Bacon grease can be a reason. Cholesterol and fat, when it's been sitting in the blood vessel, it just forms these clogs. So it's kind of like a clogged drain. And so that's exactly what happens.
So is it then, if it's a heart attack, the clog is close to your heart? If it's a stroke, it's close to your brain?
Yes, it's the blood vessel in the brain.
Okay.
So when that part of the brain stops functioning, then you have the signs and symptoms. We can talk really quickly about some of the signs and symptoms of a stroke. I know you guys have heard of that acronym called BFAST, BEFAST, that helps you, quickly think about whether you or the person that you're with is having a stroke. And B stands for balance, when the person is losing balance or coordination. E is for eyes. The person is experiencing double vision or unable to see out of an eye. F stands for face, when one side of the face is drooping. A stands for arm, when the arm is weak and you're not able to raise your arm. S stands for speech, when person starts to slur their speech. And T is time. Time means call right away if you notice any of these symptoms happening in a patient. So all these symptoms are happening because that portion of the brain that normally does these functions is no longer working. So you experience these symptoms.
And that a heart. Okay, sorry. Go ahead, Nancy.
Oh, I was going to say, does the person actually have within themselves? Do they have some kind of inkling or warning sign that they can recognize that? I mean, I understand you could be watching someone else and go, oh, that's stroke or that's a heart attack. But the person themselves that's suffering from this, is there something that tells them, hey, you're in trouble?
Well, not until they start having symptoms. Not until they have symptoms, because, as the clog is slowly forming, the brain is able to compensate. But once it completely shuts off, then these symptoms happen. So usually patients are aware, they're trying to talk and nothing's coming out, or their speech is slurred, or somebody's watching them and they're just not quite acting right, and, they feel like something is not quite right. So some people know when this is happening most of the time. And may not be able to articulate it. But if you know these warning signs, you see it, or you have somebody else with you that's having these signs, you need to call 911 right away.
So the heart attack versus stroke thing, because the heart attack is different. and it's going to be different between men and women. With stroke is the same for men and women.
It's the same kind of symptoms that men and women have, yes.
But a heart attack is different, right? So
yeah,
a woman doesn't hold
women,
her chest or any of that.
Yeah, women may not necessarily have the classic symptoms. We all know the classic symptoms of heart attack, which is the squeezing chest pain, because that tissue in the heart is not getting oxygen, so it hurts. And so the classic sign is the chest discomfort radiating down the arm or up the neck, and sometimes women don't have those symptoms. Women can have very non-specific symptoms, which then goes to the pathophysiology of the heart attack. Men tend to have the heart attacks where you have the plaque ruptures and it's acute, and women tend to have more small vessel disease, which kind of presents differently. But overall, most people do present with chest pains and shortness of breath, but a certain fraction of women may not necessarily have the classic symptoms associated with heart attacks. So it's very important to be aware of that.
What about blurred vision? That's what I've seen with, high blood pressure and things like that, where people get blurred vision.
Yeah, so one of the things that can cause a stroke is high blood pressure. Again, when your pressure is very high, you're not getting enough oxygen to the brain. And so the portion of the brain that deals with, proper function of the eye isn't working well. So people can have double vision or blurred vision. So if you're having high blood pressure and you're having these symptoms, that's definitely of concern. It means that, you really need to work to get your blood pressure down, because you are or may be close to having a stroke. So you can have...
yeah. Go ahead.
So with a stroke, like I said, it's because you're not getting enough oxygen. But if you're able to open up that artery quick enough, a person can recover 100%. But if that artery doesn't get opened quick enough, that tissue can die, because we say if tissue hasn't gotten oxygen in 10 minutes or something like that, the tissue completely dies, and it's non-reversible. So that's why it's important to make sure you call 911 as soon as you're having these symptoms, because you can go to the hospital and get intervention and have that artery opened up, and that tissue has the potential to recover, and you can actually go back to normal.
Okay, but if you don't recover and it becomes dead tissue, what happens to the tissue and what happens to you? I mean...
Yeah, so you lose that function completely. You completely lose that function. So your slurred speech or garbled speech
will stay there.
Never return. Yeah, it'll stay there if it doesn't get back. Your weak arms will continue be. You'll never recover function of the arm and those kinds of things. So that's why.
But there's some people who have a stroke and then they go through therapy and kind of get back right through that.
Yeah.
How does that work?
So long-term therapy, you can go to physical therapy. I mean, it's probably not going to be normal like it was prior to the stroke, but definitely you can regain some function and be able to carry on with your normal activities. But
so this is why it's important that people do actually have the "I've fallen and can't get up" little beepy thing, because if you're like, if you're elder and you're living alone, the chances of you calling 911 is pretty slim, right?
Yeah.
So it's it's important. But I know so many younger people having strokes lately, and I wonder what that's from.
Stress.
I mean, in their 40s. Why are people having strokes in their 40s? I mean, did their pipes get full fast or what?
Well, we're seeing a lot of, these risk factors that we always talk about with heart disease, which is the same for stroke. We're seeing that in younger and younger people here in the United States. Some of the risk factors like obesity, decrease, not exercising much, smoking, excessive amounts of alcohol, having high blood pressure. High blood pressure is a big risk factor for stroke, having high cholesterol. So we're seeing these in younger and younger people, and it may account for the fact that we're seeing, these symptoms in younger and younger people. So again, lifestyle changes also applies to stroke, because if you can keep all those things at bay, you really decrease your risk of having a stroke.
So now let's go back to the chicken and the egg. What comes, I mean, because it seems to me like I have friends that have had both, and some are not here to talk about it anymore, unfortunately. And so does one kick off the other, or like once you have all those symptoms and you've kind of pushed your body to the max, you're basically going to end up with both? Like, how does that happen?
One doesn't necessarily kick off the other, but having one increases your risk that you have the other, because we're talking about risks in general. So if you're obese, you have high cholesterol, you have a high chance that cholesterol is going to form plaques in an artery. So whether the artery is the brain artery or the heart arteries, it's going to form somewhere. So it's going somewhere. So you expect to get one or the other or both. So it's about your risk factors. So if you have if you have hypertension, if you have high cholesterol, you have diabetes, and you're obese, you're not exercising, you increase your risk of having both, because the arteries, the plaque can form in any of the arteries. So it's not that you have a heart attack that then causes you to have stroke, but it's the fact that you have these risk factors that increase the risk of clogging your arteries. So it can clog any artery in the body. So
where
does the brain or
where does plaque come from? What is the plaque that you use to talk about plaque? Like, we know about plaque on your teeth, and if you don't brush your teeth.
So it's like cholesterol and fat. So when you eat all these high cholesterol meals and fatty meals, it forms like clots, or plaques in your arteries. So just like you talked about baking grease that goes down the drain and clogs and forms hard clogs, that's exactly what the cholesterol does in your blood vessel. It forms hardened plaques. Just by sitting there and being in the blood, it attaches to the blood vessel and it just forms these clogs. And so,
it's just like why we have to soak dishes when we cook, right? So if you're cooking,
yeah,
get that hard rim. It's that hard
Lisa
rim
cooks, we have to soak a lot of stuff.
I know. That's what I'm saying. Like, this is how I know all of this. It's
That's
like,
called
okay.
burning.
Yeah, well, I don't cook bacon very often. I've done it once in the last 10, 15, 20 years because I did it, but I was like, oh, wow, that's like like when you see how much fat comes off of that.
Yeah.
Like, seriously,
exactly.
I am like, I understand when people look at certain foods and go, that's a heart attack waiting to happen. I'm like, holy cow.
Exactly.
But you better not be putting all that down your chest. Like, seriously, I've got Dr. Jackie sitting there on my shoulder going, you're filling it up. You're filling up those pipes.
Yeah,
it's not good.
Really, it's just really salt.
But really, it doesn't go down. So let's just go back to the pipe system. So, if you keep putting stuff, then the grease hardens on the pipes, which is your valves, right? Starts hardening. And so we don't have Drano? We haven't come up with Drano for humans?
Well, that's what they'll do to you when you actually get to the ER.
Oh, we don't?
They give you quote-unquote Drano. What was that?
Oh, I don't want the Drano from the hospital.
They're going to give you Drano?
So they give you I call it quote unquote Drano. It's not Drano, but it's a clot buster. You call it TPA. So when you get to the hospital, they give you this TPA, whether it be through your arms or directed at the clogged artery, and that dissolves the clot and opens it up. So that's why you need to get there quickly so that can be done.
So what is it actually that dissolves the clot? What is it?
So it's this. It's hard to explain in layman's terms.
Yeah.
Just take
it's
my word for it.
vinegar and baking
like
soda, Nancy.
Dissolves. Yeah.
Vinegar and baking soda and hot water for your drains.
Right. So it will dissolve the plaque and open up the artery right away.
So it's like it's medicine or like a bunch of different chemically things?
Yes, it's like a medicine. Yeah. It's a
so that's not
medication.
when you do the big kaboom thing, the electrophysiology kind of kaboom thing where I'm going to put irons on your chest and you're going to jump up. kind of
No,
thing.
no, that's not. No. Doing that, shocking the heart into a normal rhythm, you could have a bad rhythm as a result of having your arteries clogged, and then they would have to shock you out of it. But ultimately, when you're having a heart attack, which is defined as blockage in the arteries need to be reopened. And, for the brain, you can give that clot buster, the TPA. For the heart, we actually have procedures called angiograms or percutaneous coronary angioplasty, where they actually put a balloon in that artery, balloon it open to allow the vessel to open up and allow blood to flow through.
Wow. And so, like,
Okay, so
that's
is the
amazing
balloon
stuff
rubber?
to do that. Yeah,
Is it-
it's like I've
is it
seen those little
rubber?
diagrams.
What
Like
was that?
the balloons are rubber, like a real balloon? Like a
Yeah, it's like
party?
a balloon that opens up and expands. So they put a wire through the teeny little opening, and they inflate the balloon, and it just opens up the vessel.
Wow.
And then they put a stent there to keep it open.
Oh, so that's what the
So-
stent is like, kind of like a little
Yes.
peg.
Mhm.
Yeah,
Like-
keep it open. That's
And
correct.
people can keep, so people go, when I hear people say, oh, I had a stent put in, so it stays in their heart, like to keep it open? Like it's like a little prop it open door thing?
Yes. Yeah, so it's like a mesh. It's like a little metal mesh that so they balloon it up open, and then they put the stent to prop it open.
I bet that hurts. Like after the painkillers and stuff, that later you
No,
move that
patients
part
don't
of your
typically
body.
They
Really?
don't typically feel. What hurts is when they initially balloon it, because when you balloon it, you don't get any oxygen to the pieces of your heart. And usually when patients are having this procedure, they're under sedation anyway, so they probably
They
don't
don't.
remember it.
Yeah.
Yeah.
But
Wow.
once you put that on, you typically cannot feel the stents in your heart.
So when you
But
do
it keeps the vessel open.
electrophysiology side of things, like are you doing things that's not just the shocking of things open, like you're doing, like it's interesting to me about the electro thingy. Like, okay, can tell I'm not a doctor, but like we've talked to psychiatrists and stuff talking about like when they used to zap people's heads, like in mental health things, like go bing, bing, like zap, zap. And it looks terrible, right? But they're saying that it's still used today in a better way, but it really has produced really positive results. It's not like this archaic thing. There are some really big positives. So I'm wondering about these electric currents and how they help our body, because we do create our own electricity. So it is kind of natural that we're using electricity because, I mean, we zap ourselves all the time just from kinetic energy and static energy and whatever, but we do create electricity. So it's kind of interesting to me that it's all connected in a way, right? Or am I just on my own little trip?
No, we do need electricity for the heart to function normally. It's the electricity that garners the energy that the heart needs to generate that pump so that blood can be pumped to the rest of the body. But sometimes the electrical conduction is abnormal. And we need electricians because the electrical connectivity in the house is abnormal and needs to be fixed. So you can have abnormal electricity, and that's where I come into play. I come and help fix that abnormal activity so the heart can beat normally and pump blood normally and overall function normally.
So it's like our pump, our backyard pump, and you have a little fountain, and if the pump doesn't work, then everything gets dirty and clogged. And there you go. Now you're going to have a stroke or a heart attack. You don't want that.
Right.
Okay, so are there times like, okay, so now we understand that the veins get clogged, so you're not getting enough of the arteries. Oh, not, okay.
So the arteries are the vessels that supply the organs with the oxygen and nutrients it needs. Vein takes the oxygenated blood away from the organs. The arteries take it to the organs. So it's the arteries, when they get clogged, that's where the problem is.
Oh.
That's good.
I love this. This is like we're like medical school, Dr. Jackie.
So
and we have to dumb it down to houses and pipes. I like it. This is cool.
So is there something that gives you a premonition that something's wrong with your arteries. I mean, long before you have a heart attack or you have a stroke, is there something that tells you, like, if you have high blood pressure,
Yeah.
if you
So
have
yeah,
low blood pressure,
well, for heart attacks, if the clog is building slowly, you may have some symptoms we call angina. And those happen, you start to have symptoms with physical activity. First of all, it starts off with heavy exertion that causes chest pain. And then it starts to get worse in that you start to do minimal physical activity. And then you start to have symptoms. And this is because, when you exercise, you definitely need more blood flowing through the heart. And that's how you're able to supply the rest of the body and function. But when that artery is starting to get clogged, it's not able to supply the body or the heart with the amount of oxygen it needs to sustain heavy exertion. So your body warns you that this is happening by causing chest pain and preventing you from being able to do these activities. So it starts off with you not being able to do heavy exertion, and then as it gets worse, your physical capacity level continues to drop. And hopefully you're able to, you tell your doctor before it gets to a bad point. But once you start noticing that your physical exertion level is not the way it used to be, and something that happens more acutely, you really need to let your doctor know, because that could be a warning sign that there's something wrong.
Does it have anything to do with your thyroid glands at all?
No.
Okay.
It's unrelated to thyroid gland, yeah.
Well, it seemed like everybody suddenly, all the women I know, like in their mid years, were like, oh, I have a thyroid problem. I have a thyroid gland problem. It's like, that's why I'm overweight. And I'm like,
everybody's kind of saying that.
Like, so I'm just going to walk around and say, I have a thyroid.
Yeah, no, that's so no, because it is true. We hear that a lot about the thyroid.
Well, yeah, the thyroid deals with the metabolism. It deals with your, metabolism of the body. And if your thyroid is really low, your metabolic rate is low, and you tend to gain weight. You can't lose weight as quickly. But you should get your thyroid fixed, and that shouldn't be a reason to not do physical activity and get your heart healthy. You need to, fix your thyroid by taking medications or what have you. Because even though you have a thyroid problem and if you gain weight, you can still have a heart attack. But if you have a thyroid issue, then you take care of your thyroid issue.
So that you don't gain weight.
Yeah, so you don't gain weight, so you don't have heart disease.
Yeah, so now, because I mean, your body's all related, one organ to the other. If something goes wrong on this side, eventually it's going to go wrong on the other side.
It's a big traffic jam, I'm telling you. It's a big traffic jam of what's going on in our veins, arteries, and pipelines.
It's like Interstate 5.
I know, like especially if
sometimes you can move and sometimes you just sit.
But I want to go back to the strokes, because I think it used to always be men who had strokes. Now we're seeing more women. I don't know if it's just me thinking that, or
they're just quiet.
I mean, like I say, younger people, and I'm seeing younger women too. But what about these mini strokes that people are having that they didn't even know they really had a stroke? Do you know what I'm talking about with that? Like people like seem to have like tiny strokes, like that they just don't know that they almost like tiny mini seizures in a way.
Right.
And they didn't realize it.
They didn't realize. So sometimes, it can go. It could be, because you would have to, each case might be different.
Yeah.
You have to examine each patient to determine what it is that they have. But sometimes you can have, blood clots. Your body, your heart can flip a blood clot up to the brain that causes just transient symptoms that resolve when the blood clot either dissolves or moves on. So you can have a transient episode of these stroke-like symptoms where you have blurry vision for just a few minutes or what have you, or your arm going weak, your facial droop for just a few minutes, and then it completely resolves. So we call that transient ischemic attack, or TIAs. And those are just mini strokes because they resolve for whatever reason.
Oh, wow.
So yes, that is possible.
So like when my friend died, when he was taking a shower and at a blood clot thing, he was really sick with the flu, and then this is what all I know, though. And then he passed away. He died from it. He had a clot that
Yeah.
went up. So that would be like a stroke. Like if you died from a blood clot thing, that would basically be a stroke, right? In some form.
Well, it depends on where the blood clot went.
Yeah.
If it
Oh.
went to the brain, then yes,
Yeah.
it would have to be like a major stroke. If it goes
Wow.
to the heart, it can cause a heart attack. And the other place that it can also go is to the lung and cause what we call a pulmonary emboli. And if it's a big
Oh,
enough
Yeah.
emboli, a person can die from that.
Yeah.
wow.
And
And
also-
whatever happens to your lungs, it affects your heart, right?
Also, I
Yes.
think if
Yeah.
you slip and fall in the shower and you hit your head,
Yeah.
that can cause a lot of things. I mean,
Yeah, if you bleed into your head,
mhm.
it can also cause damage to the tissue, and that would be a different kind of stroke called a hemorrhagic stroke. Whereas, the typical strokes, not typical, the one type of strokes where you get the blood clots or the plaque formation, the stroke happens because you don't have oxygen to that part of the tissue. But the other kind of stroke is when you actually bleed into the tissue, and the tissue in the brain doesn't like that at all, and that can destroy the tissue and cause symptoms that are similar to a stroke or that are from a stroke, because that tissue is not functioning normally. So yes, you can have different kinds of strokes, whether it's hemorrhagic from falling, hitting, bleeding into it, or what we call ischemic from lack of oxygen.
I know
Different strokes for different folks.
when I worked
No, I
for
mean
insurance-
seriously, but it's a
when
bit different. I don't mean it lightly, but it seems like here's the stuff we can prevent, and then there's the accidental stuff, like what happened with my friend. He did slip in the shower, boom, there we went. And I don't say that lightly, because if I have to deal with it in humor. But
No,
I mean, all of this is heavy stuff because so many of us have friends, family that have, or personally gone through something like this. So it's strokes and heart attacks are traumatic to the individual and the family and the friends. It's just, it ripples through. So sorry if I have some humor, because to me, we've got to lighten it up a little bit, because we don't want to, we don't want to have a show where we feel we're all going to die, but we all want to be inspired to do the reversal that Dr. Jackie's talking about, because an accident is an accident, right?
Right.
So that's one side of it: stroke, heart attack. Like, look at the school shooting in Texas, and the one, the husband of the one teacher, he died right after her, just had a heart attack. We've talked about that on shows, Dr. Jackie, where people can just have a heart attack out of severe grief, right? So that's different.
Yeah.
You can't reverse that. You can reverse.
So somebody like that probably has risk factors for heart disease. I don't know his history, but more than likely he had some risk factors.
Right.
And so extreme emotional stress can just push you over the edge for something that was coming.
If you're in an extreme emotional state, doesn't your body emit more chemicals than normal, and everything's on high alert? This is like
fight or flight, exactly. You have all these adrenaline hormones moving around, which then can cause rapid heartbeat, shortness of breath, and can trigger a heart attack in a patient who has risk factors for a heart attack. And that, that's most likely what happened with this person. But I don't know, because I have not reviewed his record. But I will assume that that's probably what happened. Although there could be other reasons for his heart attack as well. But
it's sad.
I would guess
it's
that's probably what happened. Yeah, it's very sad. Very sad.
When you think about this, do you, when you think about these kind of one-off episodes where someone has these issues, like they have can high blood pressure, like an immediate high blood pressure incident, do that? Can
Not
that
immediate, usually chronic, long-term high blood pressure. If you get it high acutely, maybe you'll bleed in your brain because the pressure is too high. But more often, it's high blood pressure over prolonged periods of time that can cause that.
Wow. So it has to be kind of there. So it's not just
Yeah. So
wow.
yeah. So someone can have high blood pressure and not know that they have it, because we say that hypertension is a silent killer. You can have it for a long period of time, and your first manifestation of it is that stroke that puts you in the hospital.
Wow. Wow. Well, I think I want to go take a good jog and eat some salad for dinner and even forgo the 5 ounces of wine tonight. I'm just saying. I don't want to, because it's scary, because sometimes, there's, I think what's scary, let's talk about this part, because it is the scary part. You can have a stroke and come out of it basically not functioning with your
Yes.
speech, your body movement. So you may
Yes.
actually at that point end up having to be in full-time caregiving or have a full-time
Yes.
caregiver or something.
Yes.
So it's not like, okay, I had a stroke and now, had a scary time in the hospital, take some medicine and change my diet.
Exactly.
You can actually be
Debilitated.
completely, there's the word, yeah. Yeah.
Requiring a feeding tube to be fed, requiring a breathing tube in your neck to breathe. Yeah, it can be debilitating. You go, if this happens to you in your 40s or 50s, I mean, what kind of quality of life will you have after that? Not very good.
So yeah, well,
To be taken
some people
seriously.
I know, they had a series of young, and eventually they just kept having these strokes, and then she passed away young.
Yeah.
It's just hard to see women at a young age go through that. You try to make how did that happen? And the caregiving part and watching people go through that with a stroke is hard, and hard for the patient, hard for the person going through it. But then some people can just die, right? That's the other part. You
Yeah.
can go through a stroke
Yes.
and you either come out of it
Die
or
immediately.
you are debilitated or you move on up,
Yeah.
And then same for a heart attack. With that,
Same for heart attack.
so can a heart attack make you be in a position where you need a caregiver?
Yes, if you have a major part, we rarely see that these days because we have such excellent therapy for heart attacks, and people come to the doctors they get the medical attention right away. But it can happen if a significant portion of your heart is damaged from it. You can have severe heart failure, which can be debilitating.
Mm.
Or
it
can cause valvular problems as well. Yeah.
We've talked before, like some heart disease is hereditary. And so you want to know, a lot of people that do this, their DNA for through whatever company, 23andMe, I think it is, and all those places, a lot of times they're doing it for their medical history. It's really hard if you're adopted, to find what your medical history is from your past. If you've got diabetes in your family, cancer, and you talk about heart disease too, but like having a stroke, does that travel through your family? Or if you have heart disease in your family, you need to know that you're already on the list for that. Like if you have heart disease, it's a possibility for stroke.
Yeah, so it's mostly, risk factors when it comes to a stroke. The same kind of risk factors with heart disease. And when you talk about family history, I guess if you have a family history of high cholesterol, then yes, you would be at risk. Well, so you would have to keep your cholesterol, your blood cholesterol level in check.
So we all have to just do it. That's it. Mediterranean diet and lifestyle. Yes.
That's right.
Everybody,
studies show you can reduce your risk of a heart attack by up to 80% by implementing these simple lifestyle changes. And this is true. This is definitely a true statement.
So no smoking?
Yeah.
No smoking, no drugs?
So no. So quit smoking if you do. Exercise, you want to at least do moderate amounts of exercising. We said 150 minutes a week. moderate amounts of alcohol, which we said 1 glass for women, 1 glass of a 5-ounce glass a day. If you have hypertension, diabetes, or high cholesterol, you want to make sure you regulate that. You want to try to maintain a healthy weight, and those kinds of things. Exercise. And the Mediterranean diet is an excellent way. We have a lot of data that shows that it can reduce your risk for heart disease because it encompasses not just eating healthy, heart-healthy items, it also encompasses exercising and lifestyle changes.
And walking, taking walks, all that good stuff, and meditating and chilling out, so it's good stuff. And everyone, Dr. Jackie's in the most recent issue of Eat, Drink, Be Merry magazine, our Big Blend Eat, Drink, Be Merry magazine. You can check that out at blendradiontv.com, and her other interviews and articles there too. But most importantly, go to womenandheartdiseasebook.com and get her book, Women and Heart Disease, The Real Story. Really, she breaks it down, and there's stories in there sharing examples, true examples of what heart disease looks like, and especially for women, because like you were saying earlier, it doesn't present itself the same as men, and it's kind of a hidden, quiet killer of women. So check that out, and she really gives great tips on how to reverse things. But I think the smoking is the worst. I really think, just on my own side, on watching all the people I know that have gone through heart disease, heart attacks, other than genetically, and it's the smoking thing was always there,
I
so
agree.
that's still there. And this vaping thing, even though it's not nicotine as much, is it as bad as smoking, or is it something people should watch out for? Okay.
It is as bad as smoking, and it's terrible because you have all these vaping things that have candy flavor, so it appears as though it's being marketed to young people. So you want to get them hooked on this nicotine, while they're young, so they can continue to use the product. So it's bad. It's just as bad as cigarettes, and so vaping, one should not vape.
Because I have a friend who's like, oh no, it's less nicotine, so I'm doing this to cut down on smoking. I'm like, Dr. Jackie says no. She says no.
Stay away from it.
Yeah. Oh, well, thank you so much, Dr. Jackie. Everyone, keep up with Dr. Jackie, as I said, on womenandheartdiseasebook.com. She's also on Facebook. And, of course, keep up with us at bigblendradio.com. Dr. Jackie's here every third Wednesday. Thank you so much, Dr. Jackie.
Thank you. Good. Thanks for having me.
Always fun and interesting and informative. I am going to go eat a salad now.
Well, good. I'm glad to hear that. Okay, you guys enjoy your day.
You too.